Okay, today's webinar is brought to you by Kinetic, who is an MHPA partner and supporter of our member health plans. We thank them for organizing today's presentation, Modernizing NEMT and Medicaid, Access, Integrity, and Accountability at Scale. And with that, I'm excited to turn things over to Becca Geist, who serves as National Director of Government Programs at Kaiser Permanente. Becca?
Thank you, Patrick. First of all, thank you for having me here today. Everyone knows that one of my favorite things to do is support MHPA and your plan partners, and happy to be here with you all today. We have what I would describe as a hopefully innovative session for you all, talking about non-emergency medical transportation. I'm going to be introducing Sufyan, who is the founder of Kinetic, a non-emergency digital transportation company that I would describe as positively disruptive in the industry. And there are a lot of differentiators that Kinetic has compared to traditional models that increase the not only the patient or the member outcomes, but can be applied in a variety of ways to drive outcomes and increase access to care. Also, so thrilled to have Drew Peterson with us, CEO of United Healthcare New Mexico Community and State Market. And we are going to get into, we have a lot of questions and would love for this to be interactive with you all today. So you're going to see today that Patrick is graciously going to be dropping some polls into the chat. Would love for you guys to participate with us within those polls, and also feel free to drop questions. We want to make sure that our participants are getting what they need out of this informational webinar too. So again, really thrilled to have Kinetic here, which is a partner to states and health plans, and have Drew that is a partner to Kinetic within United Healthcare New Mexico. So with that said, I'm going to get in just, again, we have a jam-packed agenda. So we really want to make sure you guys understand the topics today and just some of the cool things that Drew's doing in New Mexico and that Kinetic is doing nationally, and there's a lot of exciting things on the horizon. So Sufyan, I'm going to actually give my first question to you. And one of the questions is that NEMT, I think we all can agree, if you can solve transportation, like think about the cool possibilities and the member outcomes and access to care, and just how that actually, from a feel-good perspective, not just a operational perspective, really can impact someone's life. And I'm talking on broad scale. We're really going to focus today on urban and rural as well. So Sufyan, what do you think is one of the kind of greatest opportunities that NEMT programs have today to actually modernize and move traditional NEMT models to kind of keeping up with digital technology? And just what do you think from an operational perspective, how Kinetic and NEMT can, innovate in this space?
Yeah. So the challenges within the NEMT marketplace, it's multifaceted across the board. So you have states and payers involved, then you'll have brokers, transport companies, their respective drivers, and then ultimately the people that matter the most, it's the members. And today, a lot of it, we're using technology, like it's a somewhat digitized market, right? Before Kinetic, a lot of these folks were using transport, solutions like, dispatch products, et cetera. The challenge is the interoperability piece. In order for us to solve for the member experience, which is to modernize it to the point where every member can potentially request a ride through their mobile app. In order for us to get there, we need to digitize the entire network. So there's two folds to that equation. One is that the transport companies need to be on a dispatch system that's sophisticated enough where it could integrate with other technologies. For example, our product allows health plans to take this benefit in-house and manage it in-house. But if we can't integrate with the dispatch solutions that the transport companies use, it kind of takes away one of the biggest differentiators for Kinetic. And the reason that's important is because you want to be able to assign and reassign these trips in real time. Now, if you don't have proper API integrations with the workflow tech of the transport company, which is a dispatch solution, then you can't see, what's under the hood, pretty much. You can't see the available drivers in that network. One of the biggest challenges in this market for members are not necessarily booking the ride to get to a point of care. It's getting back home. And oftentimes what you'll have is a last minute cancellation for whatever the reason. Maybe the appointment took longer than expected, or maybe the driver's tires got punctured and the driver couldn't show up. And what you need to be able to do in real time is reassign it to the next closest driver. And because historically the industry has been non-interoperable, you can't do that in real time. You need to go through a slew of different brokers and transport companies, et cetera, to find the next available driver. So for members to have this real-time experience, for us to bring this to life, you need to start with interoperability. You need to start with technology where you could easily integrate with the products that we're building out, and to gain visibility into those rides and automatically reassign to the next available driver and so on.
Now, I'm going to actually, I know our audience is probably having the same questions as I do. Drew, before I go to you, I'm just going to ask Sufjan just a quick question where, I might be naive in this space, so I'd love to be educated too. This sounds like Uber and Lyft for medical transportation, because, when I'm looking for cars, it can reassign cars, or, those things happen. How are you partnering, or how is this similar to an Uber and a Lyft, but expanding into the medical space?
Mm-hmm. So rideshare companies play a critical role in this ecosystem, but they are limited in terms of the rides that they can perform. So oftentimes it's curb to curb ambulatory rides. Every state, because it's a Medicaid, we're focused heavily on in the Medicaid space, because Medicaid is administered on a state by state level. Those states govern how transport companies can work. So you've seen it historically where rideshare companies have faced their fair share of challenges entering or penetrating new markets. A lot of the states, especially when it's federal dollars, they do empower local businesses, and they want you to prioritize working with local businesses. So, as great as the rideshare companies are, they're limited for many reasons, one being legislative issues, right, around it. But more importantly, they're not really in the space of performing, higher levels of services. A lot of these rides are rides to your dialysis center, for example, or a lot of these rides are for chronic illnesses where it needs extra care, and the driver needs to be trained a specific way. The rideshare companies that are out there, they're not necessarily training the drivers to perform higher levels of services. It's curated services, and the local transport companies understand their local markets better than national players do. So that's one of the biggest advantages that local transport companies have over national rideshare companies. But rideshare companies play a critical role in this, especially for recovery rides. They're the fastest to get to it, right? Because they have such a vast network of driver partners, et cetera. So it's a mixed bag. What we're doing is we work both with rideshare companies, but also digitize and empower local transport companies and appropriate rides based on the need of that member.
Thank you. So that just prompts an easy question for me to throw to Drew. Drew, as I come today from Oregon gets rural real quick, and everyone knows I'm a rural girl all day long, grew up in rural Oregon. And as I think about with what Sufjan was just talking about, the network, and obviously as your role as a health plan CEO, and making sure your members and your providers are successful, right? Because it's both, sides of the house, right? It's part of that ecosystem and getting care. And as I think about too, providers and value-based contracts, you need the members coming in, right? And when I think about equitability to access to care, urban, rural, very different. We're used to it in New Mexico, similar to a lot of states, and we probably have folks broadcasting or sitting in from these states where it gets rural real quick and it's kind of desolate, right? Drew, from your perspective in New Mexico and thinking about your geography, transportation issues, and access issues, how has your partnership, as Kinetic is one of your plan partners, not only increased how you operate, but how your members within the ecosystem of care are having a different experience? And can you talk a little bit about the network on the ground and what that looks like and how that continuum of care, starting from you being at, obviously overseeing a large operation, how this changes fundamentally your operations and translates to the provider satisfaction and the member satisfaction? So big question, so take your time.
Okay, sure. Thank you. Well, yeah, let me paint a picture of New Mexico. So New Mexico is 33 counties. 31 of those counties are either rural or frontier, which is beyond rural. New Mexico is the sixth largest state, and the only state that is more rural or frontier is Alaska, right? So there are large spaces that have a lot of distance that need to be covered. A lot of times, members come from 150 miles away to go to Albuquerque or Las Cruces to a large kind of metro area for a clinic or for a hospital or for care. So there's a lot of things with distance. I'll give you some stats from CMS. Adults with disability are 3 times more likely to report not receiving care because of transportation concerns. 25% of missed clinic appointments are due to chronic transportation issues. And then the last one, 2023, 21% of US adults went without needed medical care due to transportation barriers. And that is primarily in Medicaid and somewhat in Medicare, but there are real issues in the United States with getting to care, and in New Mexico specifically because of the ruralness and the distances. I think with our relationship with Kinetic and as a transportation provider, the best part of it is the information, right? So it all goes back to the information, looking at end-to-end transportation information, being able to track it real time or near real time, as far as geo markings, as far as an automated system that is looking at drop-off times and pickup times, so we can really ensure that quality. And so in any transportation system, I think you really need to aim for that quality. When we came to New Mexico back in 22 and we're looking at bidding for the Medicaid plan, we sat down with dozens of Medicaid recipients at different health councils, and we listened to their concerns. Transportation was a huge concern. And so it was obvious that they were not satisfied with what they were getting at that time. Missed rides, people would not, drive down a mile of dirt road to pick somebody up. So you had people walking a mile to get to where they need to go to get to the car. So there was a lot of dissatisfaction. And I think that information and the tracking brings quality, and quality brings satisfaction, brings retention. There's a whole host of things you can do when you get that quality.
So a couple of follow-up questions, because this is quite enlightening to me. Given the vast geography you serve, the transportation network has actually increased, in this instance. And you talk about kind of digital marking or geocoding. I can imagine from a financial viability that tracking, right, is actually, there's a return on investment. I mean, Keith, I might be reading too much into the tea leaves, but I know that as you mentioned CMS, I think we all see this where you talk about like crushing fraud, waste, and abuse, and my mind immediately went there.
Right, and I'll just point some things out, and not necessarily fraud, waste, and abuse, but efficiency and quality. So we know that Medicaid recipient X is going to an appointment, and then we realize that, hey, this person's going 100 miles to see this specialist. They could see that specialist 20 or 30 miles away. Why are they doing that? Why are they going so far? And so it's checking with that Medicaid recipient and saying, hey, you're driving past 2 or 3, 4 specialists that you could use, and really spending an extra hour or 2 hours of your day in this commute to go see a specialist at a medical appointment. How about we help you get a specialist closer to your house? And sometimes, people are doing that because they don't realize there's specialists nearby. They've always done it this way, right? So it's really providing the patients better options. And if you start giving those options to patients, then it's a trickle down effect in their life, right? They get 2 hours back on that day, and they can see a doctor that's either in their community or near their community rather than driving 100 miles. I'm saying that trigger, not all the time, but sometimes, is that transportation, because we're tracking that information and saying, why is this person going to see Dr. X
I
100
love
miles
that.
away?
So it's almost like a play on your network management tool at the member facing level, essentially.
Right, right. And we want to have members see providers in their community or close to their community, so they don't have to do that big commute. And so a lot of times we catch that just in care coordination, but sometimes when people are not in care coordination, we'll catch it based on the information we receive from NEMT information and saying, why is this going on? It doesn't make any sense. So we can go back and offer them something else that might be better, better for their lifestyle and better for their health.
Oh, I love that. So it sounds like bringing NEMT in-house is actually increased operational efficiencies versus creating additional burdens for your team.
Right. I would say that, yeah, absolutely. The other thing is, in the relationship we have right now, we have our customer service advocates trained on the software needed to use to provide rides. And so it's not, hey, I have to dial this number and talk to these transportation providers over here that don't know anything about me, that don't have access to any information. You are calling a United Healthcare advocate in the state that has access to all of your information, like, where have you gone before, all your other information. It might be social determinants of health information, and we can answer a lot of other questions while we have you on the phone, and we're making that transportation appointment. So I like that too. That's the model we chose to do, and so we're not farming that out to Kinetic. We're really having that in house. So our member advocacy teams gets another touch point with the patient and gets that loyalty, and we can help them. They might say, hey, while I have you on the phone, I'd like to get another Medicaid card. Or, hey, while I have you on the phone, I have a question about dental benefits, right? So we can service them. If they were just calling a transportation company, they don't know about dental benefits. They don't know about getting another Medicaid card. They'd have to transfer, right? So having that, our advocates are making the actual transportation appointment, I think, is very powerful for us.
Yeah, and having the data. So Sufjan, as Drew was talking, my head's spinning with questions. So can you talk about, Sufjan, about your, Kinetic as a strategic plan partner to states, to payers, to providers, et cetera. Can you talk about the rich level of data? Because this is data maximization at its finest, essentially, right? We all know bad addresses, where you're able to capture all these things based upon your technology. Sufjan, can you talk a little bit about the way Kinetic, as Drew kind of mentioned some keywords like choice, this is how we chose to do it. Can you talk a little about the nimbleness of Kinetic and the design of the workflows and the customization along with that data exchange, and how that's supporting not only efficiency, but it's translating to a myriad of other trickle down effects. Can you talk about like how your kinetic team and your engineers and just your philosophy around that?
Yeah. So I think to make sense of data, you need good data, right? And NEMT does not have that, or historically did not have it. So our effort in building infrastructure technology where all the different stakeholders are using not necessarily kinetics technology, but technology that we're integrated with. So we might have a booking platform for the payer or the health plan, and then we're integrated into the workflow technology of a transport company. This is critical to align data and improve data hygiene. Without proper data hygiene, you can't analyze data. Historically, what would happen is, let's say a plan hires a broker, they outsource it. And to Drew's point, when you're outsourcing a program to a broker whose sole purpose it is to perform NEMT rides, the member is limited to the information they can receive. And for plans, they really want to engage with their members as much as they can, whether it's informing them of other benefits that they have they're not utilizing, or even having conversations like Drew was saying, where, hey, why are you going 90 miles when you could go 30 miles, right? The misaligned incentives between a payer and broker prevents those conversations from happening, because oftentimes if it's fee for service, the reality transport companies or brokers will make money or arbitrage on those dollars. And so it's misaligned incentives don't allow us to really integrate the systems properly and allow payers to gain visibility. And so that's why the market has been in shambles for as long as it has been. Now, our approach is once we fix the data piece, right, we could analyze what's going on with the members who are missing these rides. Why is it, what happens from a clinical perspective if somebody misses X amount of rides? In the case of New Mexico ranks 49th out of 50 states, I believe, in terms of its poverty level. It's one of the poorest countries in the country. 40% of people are on Medicaid. And if you add Medicaid, Medicare, 60%. 63% of prenatal care in New Mexico is covered by Medicaid. And the reason I bring that up is because New Mexico has one of the highest infant mortality rates in the country. The average mother has to drive 90 miles to get to a point of care. That simply does not make sense. Now, if you have proper data and if you have data-driven decisions, we could then encourage transport companies to build their network in these rural and, to Drew's point, frontier parts of the state. And why that is critical is because you could get to that member quicker. They don't have to wait 2 hours to get a ride and then get there, go another 2 hours and then come back. So they're spending the entire day. These people are trying to work. It's just impacting them in myriad ways. So data-driven decision, every market we've been to, there has been an increase of 40% in terms of transport companies that open up additional branches. So that's the data can be studied from different elements, right? Understanding, first off, cleaning up the data from a payer's perspective, gaining full visibility into what's happening with your NEMT program. Not just, hey, let me get an encounter report every 30 days, but as it's actively happening. From a payer's perspective, engaging your members beyond the NEMT program is critical, right? You're utilizing your contact center more effectively. And then beyond that, once you send the rides off to the transport companies, now you have a feel for which transport companies are high quality providers and who aren't. And you want to incentivize them even further. And beyond that, you have the members who are now having a mobile app and it's just tracking them right in the vehicle. This reduces fraudulent claims, right? You could see the deviation between a member and a driver. And then all of that, once you start studying the data, hey, what happens when somebody misses a ride? And that's when we could connect it to clinical outcomes and show the real impact of NEMT within the healthcare continuum.
You touched on a few things. I'd like to probably go just a little bit deeper with that, because I still think some folks are saying, like, well, how do you build a network, right? Like, how a sustainable, legitimate network. And I'd like to not only have you kind of answer that question about the network curation, the sustainability, legitimacy, but then kind of taking it a little bit of a step further in how you're monitoring the data. And then Drew, I'm going to tee up the same question for you to track those emerging trends and that harnessing that rich data. And can you walk us through a little bit just about what that curation looks like and in the data?
Yep. So when we go into the state, any state that we're working with the plan, we try to understand the counties that they're working with. Oftentimes, transport companies have to register with the state. Actually, with Medicaid lives, you have to all register and get a specific transportation designation, and these are publicly available records. So we proactively make those phone calls. A lot of times when the payer is already working with them, they already have a tab on who's within their network because they send the claims, the checks out to the transport companies. So we gather the existing network from the payers. We then take the state database and figure out who else is there. And we proactively call them to identify which dispatch solution they're using, and we integrate with that. So we meet the plans where they are with the number of transport companies they already have, and then we look at the state database to then proactively call others. I'll tell you this much: with transport companies, nobody's saying no to rides. If the dollars make sense, they are going to come, they're going to open, they're going to expand. They're small businesses, they want more rides. So that's how we facilitate all of this stuff. We go in, integrate with whatever dispatch solutions they have. If they don't, then we bring in a dispatch solution that fits their needs. These dispatch products, these computer-aided dispatch solutions, come in all shapes and sizes. So what works for a complex fleet might not work for a mom and pop shop that only has 5 drivers. They need something simpler and cost-effective. So we're very mindful of meeting the stakeholders where they are, and then Kinetic kind of fills the gap through integrations and such.
How do you? So it sounds like there's a ride verification to understand, like, I myself got transported. We're monitoring the data. It's kind of threading back to what Drew said. Someone could call me essentially and be like, hey, why are you going, you're traveling too far. Did you know there's this position in your community, et cetera. But Sufjan, you hit on something, the incentive, right? I believe, no, I'm not going to articulate. I'm going to let you articulate it. Don't you pay the drivers like a prompt pay model, essentially, I would call it, for lack of a better word? Tell me how you're incentivizing the driver to be high quality too, so they want to stay in your network. I believe you pay, and I think I saw something online, like maybe you just surpassed $1 billion in claims paid.
Yeah, so we processed $1 billion worth of claims since we launched our product, the end-to-end product. So it's a lot of data that you could plumb through. But the incentives are twofolds. When a plan brings this benefit in-house, they get to maximize their existing contact center, right? Oftentimes they might not be maximizing it, but they can maximize that. And then once they're doing that, then there's a fee that you typically pay brokers that kind of goes away. And oftentimes a traditional model, brokers tend to arbitrage those rides. So even if they collect an administrative fee, they'll renegotiate a contracts with transport companies, and it's a much lower fee than the one that the payer is willing to pay them for. And so that's where a lot of fat lies and waste. And so when you bring this program in-house, there's more money on the table for transport companies and their drivers. Now that's one layer. Now assume that's fine, and transport companies are making more money because they're not directly contracting with the health plans, and the drivers downstream make more money. Now, oftentimes it's on the billing side of the house where a transport company might not know how to bill properly. So they'll submit a claim vis-a-vis, the traditional claims or clearinghouse or what have you, and they can't track it and all that stuff. So we take that on for them, and we have Kinetic Financial Services where we then float the cash upfront to the transport companies if they need it instantly or if they need it on a weekly basis. We kind of set that up, and then we work with companies like United Healthcare to say, look, we'll just pay us, we'll take care of it up front. And that helps them too, because the national payers, they're just large companies with a lot going on, and transportation is a small snippet of expense for them. So the effort relative to the work needed, that just doesn't make sense often. So that's where we come in as their fiscal intermediary of sorts to float the claims up front to the transport companies, and then we just work out a deal with the plans where we just follow their 60-day payment process.
So So Drew, I think this is interesting. And can you talk about those pieces from your perspective, not only the differentiation, but how it has positively impacted your plan
I think,
and your experience?
yeah, yeah. So I think I don't know if Sufyan said it, but the key word that all these transportation small businesses want is predictability, right? They want to have predictability. They want to know, hey, okay, I'm going to get X amount of rides 3 days from now. I'm going to get Y amount of rides 10 days from now. I'm going to get, they want to look out in the future. And, any transportation company worth its salt should have a mechanism so that the small businesses that make up the transportation network can have predictability, and they're planning rides. They're asking different people from different areas to take rides, right? So that's the predictability on the operational side. On the fiscal side, it's kind of the same thing. They want predictability, that they know that, okay, on X amount, on X day of the month, I'm going to get paid for these rides in the past. And then I'm looking forward to the next date when I'm going to get another. I submit not necessarily claims, but I'm submitting invoices through the system in near real time. And then on 7 or 10 days later, I'm going to get paid again. I'm going to get paid again. I'm going to get paid again. And so that predictability makes any company, it doesn't have to be a transportation company, but makes any company loyal, right? That they're like, hey, this is really easy to use. Hey, I'm getting paid appropriately, on time, accurately every 10 days, every 2 weeks, every 30 days, whatever the terms and conditions are. I don't have to worry about it. I don't have to track people down. This works for me, right? So it's that, I think, predictability that makes the system work. They become loyal to that patient or that patient's company. So they're like, hey, I'm going to pick up a United Healthcare patient. There's no problem with me getting paid. There's no problem with me getting more bookings for next week, next month. This is a good experience for me as a small businessman. And so that's, kind of what makes the system work is that predictability.
We have a question from a participant, and I'm not sure what state they're in, but Drew, I'm going to let you and Sufyan kind of co-answer this. So Ayla asks, does this type of platform help with the driver retention and or recruitment and or quality of driver? I think we touched a little bit on some of these things. In my state, there's a huge issue with having enough drivers and quality drivers. Our NEMT is a broker. Drew, do you want to take the first stab, and then I'll toss it to Sufyan, as I think this might be more in the kinetic space.
Yeah. I mean, I think this is more of a Sufyan question, but I'll tell you from my standpoint, when we start to work with Kinetic, we, spent a lot of time looking at the requirements and the credentialing that they were going to offer, and the what the state needed, and what the transportation company Kinetic was going to ensure that every single rider had. So the person that asked the question, I think one of the ways that you ensure high quality, and again, this is not sexy. You could say, oh, this is the boring part, but it's really adhering to those credentialing standards. People have a license. The company is registered with the state. Who's their insurance provider? Do they have the right amount of insurance? So I think ensuring that all companies that you're working with have that credentialing standard, and you have a partner that will check the credentialing standard and say, hey, I'm sorry, but you're not meeting this standard. You can't receive rides until you get this insurance situation fixed. That's a huge thing that kind of brings you in at that floor of quality is credentialing. And again, it's one of those backroom things that is not talked about and is not sexy, but it's really important. And I think that starts to get you kind of in the door with quality. So
yeah, the main pieces are they are important regardless of how, it's not the shiny whistle or the bell. So if you don't, please
No.
go ahead.
Yeah, thanks, Drew. So from a qualitative perspective, spot on, right? The credentialing piece is critical to get a network of qualified drivers. Naturally, with higher quality comes a greater demand to pay them more. So until we get financial incentives aligned, this industry is going to continue to stay broken. There's a lot of money here, and we can financially engineer this thing to success. And there's a lot of fat in the middle that's going to the wrong players. The drivers aren't paid. And when the drivers aren't paid, they're not going to show up. And where you're going to attract are the wrong folks who are willing to do anything at any cost. So that's what's happening with the NEMT marketplace. When a plan takes this plan, when a health plan takes this program in-house, they are cutting a lot of fat out, and they get to directly negotiate with transport companies. And that level of transparency increases trust between a plan and the transport providers. And then there's more money to distribute to the transport providers. That's one piece of it. And the transport providers are able to then retain quality drivers. Beyond that, it's how you design the network. It's got to be a compilation of many things, public transport being one, gas mileage reimbursement. You have your traditional transport companies, volunteer rides. So you have to really come up with a consortium of different network providers. And then you have the higher quality drivers focused on those who really need it the most. And then obviously having your rideshare partners alongside you. So it's a little bit of network design, a little bit on the quality side, but more so financial incentives being aligned. When that is aligned, you'll naturally see an increase in quality because you'll be paying a premium for the right drivers. So we strongly believe in that. We've proven this in every market we've gone to. When there's more money that you cut out from the fat in the middle, and you directly work with transport companies, and it's distributed downstream, you'll see naturally grievances go down, quality increase. Simple supply demand.
So we have got some questions, and I'm going to ask one follow-up question, and I'm going to go to the questions in the chat. So you when you're talking about that excess spend, just a little bit more elaboration on that fraud, waste, and abuse. Obviously, the geo-tracking and the technology piece, and equally just some of that just unnecessary pieces, right, where Drew talked about being able to contact a member and say, hey, there's someone else closer to you, et cetera, right? And that's of no one's fault, but it's just a cool thing to be able to harness that data. Can you talk a little bit about the way Kinetic safeguards against fraud, waste, and abuse? Because obviously that unnecessary spend frees up capital, right? Or you're just avoiding spending those pieces, right? And everyone's becoming more financially cognizant around these things too. And can you talk a little bit about the FWA pieces that Kinetic safeguards against compared to traditional models?
Yeah, absolutely. It's the controls in place. To Drew's point, it shouldn't take retrospective data analysis to know that you are going to a specialist that's 90 miles away when there's one that's 30 miles away. You should not be going to a pharmacy that's 50 miles away where you have a pharmacy that's 2 miles away. This stuff is easily avoided with the digital apparatus. You could put these rules, so it's a rules-based system. If there's a pharmacy, so via Google APIs and our partnerships and integrations with the EHRs, et cetera, we know where the local pharmacies are, clinics are, et cetera, and what the best place of care is, and getting it, getting the member there the fastest and reducing all of that, right? Now, that might not be music to the ear for transport providers, but the reality is if you're getting a premium for those rides that are smaller in distance, it makes financial sense. We have a lot of transport companies that are very, very happy, that are making more money than they've ever done. And they're not having to cut corners and take them deliberately to some place that's 20 miles away when they very well know there's a pharmacy 5 miles away. So these controls are placed when we're onboarding our health plan partners. We understand their program as best we can, and then we place controls. It's a rules-based engine, which prevents this stuff from happening. So you don't have to retrospectively do it.
So,
And hey, Rebecca, I'll just emphasize something there. And again, this happens in the care coordination piece, or it can happen by reviewing ride data. We might say to that patient or that member, why are you going to the pharmacy? Maybe they're going because there's some socialization needed, right? They like to go to the pharmacy, they like to talk to the pharmacist. I get it. But a lot of times they say, well, I have to pick up my drugs. Well, let's get you into a mail order situation and you can get those delivered to your house. Oh, great, right? And so I think what Sufyan is talking about is, it prompts an engagement, it prompts a discussion. I completely understand if somebody wants to go 2 miles to pick up some medicine once a month because they engage with the people at the pharmacy and that helps their overall health, their overall lifestyle. But a lot of times people don't. They're like, oh, I can get into a mail order pharmacy. Yes, we can help you do that. And so, having those different options for members. And again, sometimes it's from care coordination, it has nothing to do with transportation, but sometimes we'll see things in the data that prompts us to say, hey, call that member, see why they're doing this. Maybe there's a better alternative.
So we have a question for you from our chat. So someone asked, how have improvements in NEMT, as you brought this in-house and Kinetic is your partner, how have improvements in NEMT reliability and call center experience translated into measurable gains or improvements in member satisfaction or access to care metrics that you're monitoring from a plan perspective? And you might have some financial incentives around those from your state partner as well.
Yeah, so we have quite a bit of penalties and incentives in this with our state Medicaid authority. And I'll be honest with you, I thought this was going to be a huge issue because it was a huge issue for the other plans, and it is a bigger issue for other plans in other states, but it has not been an issue for us. So on our reporting, we're in the 98, 97, 98, 99 percentile as far as being good at transportation, right? How we report on-time delivery, missed rides, things like that. And so we have received no penalties, right? So, I'm not getting penalized. I think the state knows that, like, people do choose United Healthcare for transportation benefit. And then there's other things that we do on top of that. Like I'll just say for the people on the phone listening, the transportation benefit is for the patient, right? But we have opened it up to the patient plus up to 3 people. So again, a granddaughter can go with their grandmother to an appointment. A mother who has to go to an appointment can bring 2 or 3 children with her so she doesn't have to get a babysitter, right? So a spouse might be able to go with their spouse to a sensitive medical appointment. And we pay for those, right? United Healthcare will pay for those.
That's one of your value, what we would define as a value-added benefit above and beyond.
That's a value-added benefit.
Yeah,
that's a value-added benefit, right? But if the transportation system was not predictable, it would be a whole bunch of egg on our face because, the ride didn't show up or the ride went to the wrong place or blah, blah, blah. It has to be predictable and a certain quality in order for you to do that value added benefit. So that's kind of hopefully I answered the question.
Yeah. So it sounds like member satisfaction to you is so important to who you are as an organization and to the care of your members.
It is, because word of mouth is everything. And so we want people to understand the top of the line service delivery and say, wow, this is a good experience. I'll recommend this if somebody asks me, I'll recommend it to somebody. So yes, we want that word of mouth to carry and increase membership.
So for plans or state partners, right? Like reassessing their transportation programs today, what questions should they be asking? You know, I think what are some like myth busters, right, that you've seen, Drew and Sufjan, that where people are like, it's hard to change, my folks don't want to manage it in-house, like all those different things that people kind of stay attached to models that particularly might be antiquated, aren't keeping up with technology, aren't necessarily maybe the most efficient for the member. What type of questions do you think, Drew, like should be going through the thought process? And Supian would love to hear you too, as folks potentially consider like a pilot or a care management concierge program. You think there's different things that we can carve out, that could be carved out. Supian would love to hear about that too, if folks aren't ready to go full scale to change. But Drew, from your hat as the CEO of a plan, what are some considerations that you would urge folks to consider?
I would urge people to say, what type of data are you getting? What type of data can you get from your transportation partner, and how fast can you get it? And will they collaborate with you on slicing, dicing, and getting into the data? I hate to say it, but you know, some people might say they're digital, but in the back room, they're kind of like stubby pencil Excel spreadsheet. You really want to know, like, okay, how are you getting the data? How does the data get to me? How do I use the data? Can you partner with me to slice and dice the data? And so that's I think the hot button question.
And I think too is, I know this is a Medicaid webinar, but we've got duals, we've got Medicare, you know, folks that are really vulnerable across the age bands. Care is care. So Sufjan, can you talk about, as we think about operational feasibility and lift, how some, I would call light or, you know, different care management pathways? I think about folks that needing, you know, oncology, dialysis, got to get to those appointments. Can you talk about how Kinetic could be a care management partner? Oh, go ahead, Drew.
One more thing, just on that point, we do have this for 24,000 dual special needs members.
Oh, perfect. Thank you.
So it's the Medicaid plan and the duals that I'm responsible for. So there's pretty sizable chunk of duals that are using this also.
Okay, thank you. So these are your, you know, you serve a very high risk, vulnerable population as a whole that you oversee.
Yeah. So, you know, you could do it a couple of different ways. You could do it, you know, within a particular jurisdiction, right? Define what that looks like, county-based, et cetera, and run a pilot program to see how effective that is and run it parallel to what you have. But then the plans need to make an investment in this. And I get why they don't, right? I've been talking to CEOs throughout the country, hundreds of plans. I get it. There's a lot going on. You know, the last couple of years I've been tough on just Medicaid plans in general. And Drew, I don't know how you do it. You know, being a CEO of a health plan, but it's tough, and you got to make a lot of these decisions, but you got to be intentional about it. So if the intention isn't there from the top, it's not going to change, because you have a lot of folks that are writing RFPs that aren't familiar with the challenges that the C-suite are facing. So internal communication amongst plans they need to convey the importance of transportation as a critical anchor to care, right? When the organization is aligned, then they get it. So if somebody's writing the RFP or scouting for the next best vendor, they don't take a simple historical, hey, we wrote this RFP 5 years ago, let's just reuse it, right? They're deliberate about it. So the plans, they've got to care. And, you know, Drew certainly cares a lot about it. So, from an executive perspective, you need to want to make a change. The other part, what I think is going on, and we're working on educating the market as best we can, is that transportation is treated like some stepchild program. It's like, okay, we'll deal with it later type of thing. And until that changes and you don't take it seriously, the market's not going to change. The drivers won't get paid enough. The transport companies won't get paid enough. And you're going to continue to have folks in the middle who profiteer off of this program. And then you have members who are continuously stranded. So the executives and the plans need to care, and there's got to be alignment there. And then when you say, okay, let's go after a pilot, it could be, you know, you could find potentially a IDD population you're going after, or LTSS, or, you know, duals, or find a specific population or high risk segment that you go after first, and you kind of design that and pilot it for a year. We're in no rush, so we could pilot it for a year and show the results. Or you could make it jurisdiction based and say, look, within these parameters, let's do all these rides and let's do it in parallel and see what that looks like. Or why don't we just do curb to curb rides and see what that looks like? Just being open to that pilot. I know a lot of plans last year went into a moratorium for pilots. It was a tough year for Medicaid, but I'm seeing a lot of that open up. And I really hope and I encourage all those that are decision makers in health plans to be open-minded and saying, look, with change comes some level of discomfort, and being okay with that, right? And trusting our track record of having helped national payers and local payers do this successfully, trusting the track record of the partner that you choose, and beyond that, taking that leap of faith with the data that's backing that leap, and going for it and saying, okay, let's define a pilot and let's execute and let's see what the results look like over whatever defined period you want to get into.
We have a fun question. Someone would like to know, curious to know if Kinetic has a model to partner with nonprofit organizations. So by that, I would assume a lot of health plans are nonprofits. I would assume that is lending to community-based organizations. So could you, or provider systems. Can you talk a little bit about, Sufyan, like the applicability and potentially, and obviously like there needs to be a funding mechanism, but how else outside of the state and the health plan model can Kinetic's tools support, I would assume that, again, that's CBOs into other, systems as a whole?
I'll take it as if it's a CBO because all the other plans are nonprofits. But yeah, we have all sorts of programs that we could run. We need to figure out what the funding source is. We connect it to the funding source. We digitize it. We don't treat large payers any different from our local partners, right? It's just built into our ethos of just wanting to fix this industry once and for all. So yeah, we work with community-based organizations. We figure out where the funding source is. Sometimes they're allotted X amount of dollars. Sometimes it's grant dollars, and we try to use those grant dollars, as judiciously as possible. There's a lack of financial stewardship here, and if we could fix that, right, and judiciously invest the money that they're getting via a grant, that also makes a world of a difference. And just so we take that same approach of designing their program, figuring out the funding source, seeing if there are other funding sources, seeing if those members that they're transporting are qualified for just payers, subsidizing. So yeah, very deliberate in the way we work to fix the problem. And we just don't take an easy way out. It doesn't matter the size of our potential clients and partners.
Perfect. Drew, we have a question that really is wanting to know a little bit more about, again, like your rural and frontier health, like a feel-good story, or how this has changed and how your comfort level, because this is just a strain everywhere, right? In many states, you've got some peer partners across the country, again, that rural frontier area. Can you talk a little bit and hone in on specifically that rural piece and maybe like a feel-good story?
Yeah, I would tell you that New Mexico has a very high population of Native Americans, and they are many times very rural, very remote pueblos or reservations in New Mexico. And what we've encouraged our transportation partner to do is they will have some transportation available on their Pueblo reservation. And what we've encouraged Kinetic to do is, seek out those Native American Pueblos and reservations and bring those transportation providers into the network, right? So, for instance, the transportation provider might be going to Albuquerque, 100 miles away for whatever reason, but they could very easily take a member from that Native American community to the doctor 100 miles away. They're in our network because of Kinetic, and so they're in the ecosystem but because we've reached out to them, now they're in the Kinetic network and we can use them for medical transportation. And oh, by the way, they'll get reimbursed, right? And so I think that's a feel good story. We've had a couple other stories where people in very remote areas through transportation NEMT that involved heart disease, right? And some other grants that we were able to get, they can go to their really a pacemaker appointment much easier now. And through some other grants that we've gotten, can get Wi-Fi in their area so they don't have to drive X amount of miles, sit next to a library, sit next to a McDonald's to update their pacemaker software. They can do it in their house, right? With that Wi-Fi. So there's I'm bringing this up as there's a transportation piece, there's another technology piece. It kind of goes together for social terms of health, but we are trying to make people's lives better. And so it definitely takes different pieces to make that happen.
I love that. And so when you mentioned the word grant, and we only have a couple minutes, so I don't necessarily want to elaborate on it, but estates contemplate through the rural health transformation grants, non-emergency transportation. I think this conversation is just so timely and interesting. And it'd be fascinating to see how this evolves. And thank you for being a champion of change and being bold enough to do it. Sufjan, we have 2 minutes left. And so we have another fun question. I think we can end with this. How does having a single source of truth across the entire trip life cycle impact fraud, waste, and abuse risk?
Yeah, so data needs to be corroborated. So we have a closed loop ecosystem. Going back to the tech infrastructure we built it with the payers in mind, the transport companies, their respective drivers and members in mind. And you have to connect this entire ecosystem and that's what we're doing. It's this closed loop ecosystem where the data is seamlessly flowing from the payer to the transport company and the transport provider to their driver. And when those rides are completed, it shows back up into our revenue cycle management platform. We have so many controls in the front end of the workflow when you're booking a trip that we reduce fraud completely, right? So that's one of the biggest challenges for, I've seen it when I was telling payers, well, if you, take away the 3-day advance notice stuff where, traditional brokers require, a lot of due diligence and stuff, and you make it in real time, does then that accelerate fraud? No, it does not. If you have controls in place, it doesn't matter if you request it 100 days in advance or in real time, those controls don't go away. So by having those controls in place, we prevent fraudulent rides from taking place to begin with. And so then it flows downstream into the ecosystem, transport companies and their respective drivers. The rides are completed, we generate the claims. The claim generation is so critical. What happens is these are all fragmented today. You'll have a broker managing with their own system, and they're going to send it via different medium to the transport companies, whether it's email or their own system. Transport company gets it, they operate, and then manually send the claims back up to the brokers who have a billing department who then send the encounters up. It's all fragmented. Here, a closed loop ecosystem. The data that's being used to book that trip is reflected on that RCM in the back end, right? So a lot of the fraud, waste controls are in the front end of the system with the controls. And then we also have all sorts of data mining and fraud detection on the RCM piece as well. And then it's quite clean. It's yeah.
I know we're at time. We've got folks kind of departing, so I want to close with, for folks that have questions, please feel free to contact the Kinetic team. I know we didn't get to all the questions today. I believe MHPA is going to release the recording. Want to give thanks to Sufjan and Andrew and our partners at MHPA. Patrick, thank you. And I want to thank everyone for taking time to connect with Kinetic today. And with that, we can adjourn. So have a great day, everyone. And Patrick, I'll turn it back to you to close out.
All right, thank you. I just very briefly want to thank our panelists, you, Becca, Kinetic. Thank you so much for your support of MHPA and our members. And don't forget about our Policy and Advocacy Leadership Forum, March 17th to 19th. Have a great day, all.
Thank you.
Bye.
Thank you.
Bye-bye.